Very good afternoon to all. Welcome to this session. Hope all the presenters are ready. We have 3 chairs today who have joined in. Dr. Dora Pachova, she is the National Vice President, LMHI, Bulgaria, Education Coordinator for European Committee for Homeopathy, Chairperson of the Association of Homeopathic Physicians in Bulgaria. She has 27 years of experience in the field of homeopathy. Welcome, ma'am.
Thank you very much.
Then we have Dr. Kanchan Desadda. She is the principal of Guru Mishri Homeopathic Medical College. Welcome, ma'am. Dr. Kanchan. And we also have Professor Dr. Anu Kapoor. She is the principal in charge of Nehru Homeopathic Medical College, Delhi. Welcome, all of you, ma'am. Okay, the presenters, we'll be calling out the names of each presenter. You'll be given 7 minutes to present your paper along with the poster, and 3 minutes for the chairs to ask you questions. You can see the timer on the side, so it keeps reducing the time. So please be in time, and also you can finish your presentation on time. Okay. Those presenters who have finished presenting can leave the room and they can attend as attendee. Any doubts, presenters, any queries you want to know? If you have any questions, the presenters, you can put it in the chat box. Okay, so let's start with the first presenter. All ready? Okay, the first presenter is P. Nidhish. His title is Introduction of a New Tool for Implementation of Standardization in Homeopathic Practice. Dr. Nidhish P.
Yes, ma'am. Hello. Am I audible?
Yes.
Okay. Should I start with the screen sharing?
Yes, please.
Okay, ma'am. Is it my screen is shared?
Yes, it is visible.
Okay. Thank you, ma'am. Okay. A very good afternoon to all the delegates. I am Dr. Nidhish, a homeopathic physician practicing in India, and I would like to present before you a new tool named Hidden Protocol, which can be used to make homeopathic prescriptions more standardized, reproducible, and consistent. In this scientific community, the homeopathic community lacks the scalability and the measurability. So, in order to implement these two things, I have introduced this tool. The lack of standardized approach in case comprehension and treatment plans have been creating a lot of confusions and disharmonies among the homeopathic physicians for so many years. So this has prompted me to develop this tool, and I have been working on this for over 6 years now, and this protocol has been tried and tested by Dr. P. Radhakrishnan, Chief Medical Officer retired, for over 2 years, and has been proven to be valid, substantial, and functional. So let's jump straight over into the protocol. This protocol contains a few tools, namely Hidden Protocol, gene ID assessments, and method of triangles. So let me explain with the help of my poster. So in the Hidden Protocol, it consists of 6 parameters, H, I, D, D, E, N. So, okay, this is a thing. Okay, so the H means the health status of the individual. So, according to Dr. Samuel Hellman, the first aphorism, the cure means from restoration of the sick to health. So, we have to identify the sick and the health status. So, first what I have done is that I have assessed the health status of the individual. The health means physical health, mental health, and his history. The history makes his story, and that is the main thing. So I have, for the physical health, I have taken the physical generals, and for the mental health, I have taken the mental attributes, which is given in table number 1. Table number 1, which is clear there. It is the awareness of his abilities, his ability to cope with stress level, etc. So with these parameters, and regarding the history, past history, family history, and treatment history. So combining these 3 parameters, we have made the health scoring for the health for the patient. And then it comes to I for the intensity of the disease, which is depending upon the nature of the disease and his daily activities. If there is a disease and which does not affect the daily activities, considered as the very first stage, and if it is life-threatening, it will go to level of 6. Likewise, in the case of duration, in the less than 10 days, it will go to score 1, and if it is more than 3 years, it will go to score 6. So likewise, in each parameters, in the health assessment, intensity of the disease, duration of the disease, the dreadfulness of the disease means whether the disease is an indisposition that does not require any treatment, or whether it required medicinal management only, whether it required medicinal along with the conventional diet regulation, etc., or is it required any surgery like that thing. And the extent means whether it is superficial or internal or vital organ, depth of the disease, and the nature of the disease means whether the disease is self-limiting or non-self-limiting or with complications. So in this, I have covered all the parameters of the modern medicine and homeopathy concepts under one roof, so that we can obtain a score, and this score, which in turn will help the physician to create a totality. So basic of homeopathy is symptomatology and totality. So if the score falls between 6 to 10, you can see the totality will be made only based on symptom. And if it is 11 to 15, it is made on symptom and pathology. And if it is 16 to 20, there will be miasm will be added to that thing. And if it is more than 21, in all scores which is more than 21, all the doctors from the beginners to any homeopathy physicians are supposed to look for the prognostic assessment. The prognostic assessment means the assessment of the case based upon the diagnosis, posture and analysis, and the HP score. And if it is more than 25, that's a true homeopathic case where similima must be prescribed, and no other home system in the world can offer any cure at that point, that expert care point above 25. And there we have our own method called method of triangles that we will use there to find out the simillimum to give to the patient. More than 30, all these cases are considered as palliative. At that time, the similarity of the symptoms along with the adjuvant medicines are used to give at that time. After the prescription is done, we have another thing called indexing chart, which will help the doctor to select the potencies based upon the percentage of the symptom covered, nature of the kingdom of the medicine, nature of the disease, etc. Along with that, we have a definite follow-up analysis that if first time when a patient comes to us, when he comes next time, we will go for the follow-up analysis where the 4 parameters are looked for. First is the whether the presentation is presenting complaints. Second is his generalities. Third is there any old symptom reappearing? Fourth point, any new symptom is there? And fifth, if there are any regions he forgot to mention. So based upon these all things, we can make the homeopathic prescription more standardized. And actually, I know that this is a research paper which requires a minimum of 40 to 45 minutes to explain. But due to the time constraints, I will not be able to explain any further. I know that this may seem a bit complicated and confusing, but I'm sure that you will be able to get a better idea once you go through the poster. So please go through the poster and do let me know if there need any clarifications. So I would like to conclude by expressing my sincere gratitude to LMHI for giving me this opportunity to present my poster on an international platform. And I would also like to thank you, all the delegates, for your patient listening and support. Thank you. Thank you all.
Sorry. Thank you very much.
Okay, ma'am.
For me, it was a little bit difficult to understand the way you work. I see you are writing posture corrections and other stuff. So give a very short example how actually you proceed with the patient.
Yes, ma'am. I will explain to you. So first of all, we will take the case according to case taking performer. And after that, we will just look for we will just score. We will just go for the physical genders of the patient. And you can see in this poster itself, there is a mark called appetite, whether it is normal or abnormal. So the doctor can just tick it.
Yes, okay.
So that automatically the scoring will come down accordingly, along with he can understand the intensity of the disease, everything can be scored. And if the case before me is a warts, and if I get a score above 60 or 20, that means you have to look for, not for the only for the warts, there is something in him that we must be extra cautious of. So I have seen many beginners practicing homeopathy has lots of confusion regarding how to practice homeopathy because they are confused with gazillions of theories. So once we made a correct totality according to the case. If you can make this, this is a start step. So what I want is that it must be developed from here so that only homeopathy can be scalable. We can make, why did you prescribe this medicine? I prescribe this medicine because this comes under this and I consider the totality like this. So there is a correct explanation for that. That is the way of method we are following our clinics.
Any other questions? I would be grateful if you invite me to see some study how students accept this and how young doctors really work with this score, because it could be really a valuable tool, and we need some practical feedback for that.
Yes, yeah. Actually, we are doing this for last 2 years for each and every case. That
okay.
I will definitely do my best.
You can mail me and send me, as I'm education coordinator, so I'm really interested on your work.
Okay. Thank you, ma'am. Thank you, ma'am. Thank you. How can I contact you, ma'am?
By mail, I will write it in the chat.
Okay, ma'am. Okay.
I think we can continue with the next speaker if there are no questions.
Thank you. Thank you, ma'am.
Dr. Kanchan ma'am, Dr. Anu Kapoor, any questions?
No, Dr. Shri, we can continue.
Okay. The next presenter is Dr. Trista Ma. She's
Yeah.
from China. So welcome, Dr. Trista. You can
Yes,
start.
hi. Okay, am I audible?
Yes, you're audible. Please share your
Okay.
poster on screen.
Okay, yes. So, okay, hi everybody. I'm Trista from Hong Kong Association of Homeopathy. Today, I'm going to share a case regarding a group analysis for a preverbal newborn based on the maternal constitution and the newborn's active symptoms. In this case, there is a preverbal newborn who suffered from suspected vaccine-induced eczema, as well as upper respiratory tract and digestive problems. Polycrest were selected and given based on simple repertorization and brought improvement, but they could not achieve a complete recovery. So a full case of the mother and baby were then clocked to find out the themes in the life of the mother, thereby finding out a deep-acting remedy for the baby. The baby was 2.5 months old and male. He was born with uneventful spontaneous delivery on full breastfeeding. He was in good condition until 2 weeks ago after his first vaccinations, which are the DPT, IPV hip, new C13, and the ROT1. He has been on anti-inflammatory lotions and creams without steroid before using homeopathy. After 3 days of lotion and cream, the skin eruption was nearly all cleared, but the baby started to cough with increased breathing rate. The cough hindered the baby from sleeping, and pediatrician made a diagnosis of upper respiratory infection. The cough was not relieved by the medication, and the patient started using homeopathy after 3 days. So the chief complaints are eczema on face, infantile colic with 24-hour screaming, and the rattling sound. Here, you can see that the eczema on the face. And the first 2 remedies prescribed were silica 30C and lycopodium 30C. After using the 2 polycrests, sleep, appetite, and colic were significantly improved. No more screaming. The stool was still watery, but face eruption was not improved. So you can see that after this is the condition after using the 2 polycrests. Given that the patient was a preverbal newborn, to shed light on his constitutional remedy, a full case of the mother, Mrs. Child, 36 years old, female, and the baby were then clocked. And after investigating the life history of Mrs. Child, we found 2 themes. The first one is the need to belong to a group. Mr. Chow had a strong desire to belong to a group. There was an intense need and dependency on friends, family, and colleagues, and a fear of being expelled from the group. But in order to get the stability being in a group, she had to follow the norm of the group. And the second theme is the concept of hierarchy. There was a concern about hierarchy in the group, which can be interpreted as an issue of superiority and inferiority. And instead of fighting or maintaining in a dominant position and not allowing anyone to boss over her, she switched to a state of submissive when there is a fall in the social position. She cannot survive alone in the wild, but belonging to the group is of prime importance. The compromise for staying in a group is that she had to sacrifice her own say and wishes. She needs to be submissive and pliable. These themes leading to a diagnosis of the mammal's remedy. And here is the repertorization for Mrs. Chow's symptoms. For Mrs. Chow, the only current active symptoms is the stomach pain since this pregnancy, which is better when bending forward. So the rubrics that are choose the stomach bending forward ambulation, stomach pain bending forward ambulation, stomach pain sitting bending forward ambulation, and the logic groups milk, dreams, pointed objects. People are hurting her at face by pointed objects. And the prescription for Mrs. Chow is Lacaprinum 30C single wet dose. And for B child, the repertorization was done for, mild, sensitive, noise to sleep on going to, rectum flatus, stool theme, stomach pain lying down back on, stomach lying back on aggravation, abdomen lying back on aggravation, abdomen pain lying back on aggravation, and the logic group milks. And the prescription for the baby was the Lacaprinum 30C Westall 5 cups 1 sip. As B child has serious eczema, it was expected that a homeopathic aggravation would occur under a medium to high potency with hard globule dose. Therefore, a West dose diluted in 5 cups of water was prescribed. We expected that the eczema would improve gradually without serious homeopathic aggravation. And for Mrs. Chow, the mother, a potency of 30C was not expected to cause serious homeopathic aggravation, given that her pathologies were not complicated, and it was estimated that her main complaints would be improved under the constitutional remedy. And the result is that Mrs. Chow's stomach ache was gone within 2 weeks, and she was advised to repeat LAC-CP 30C only if the symptom came back. And for the baby, Lacdel 30C 5 cups 1 sips was prescribed twice per week, and then gradually decreased to once every 2 to 4 weeks, according to his status in the coming 6 months. Both patients were in good compliance to the remedies. No homeopathic aggravation occurred. After 6 months after using the remedies, the baby grew well and fit. Eruptions on lower limbs were not frequent now. Lacdel 30C 5 cups 1 sip was only repeated when there was some eruptions on lower limbs. Later, it was used around once every 4 to 6 weeks. Actually, childhood eczema is a growing problem in Hong Kong. According to the data released by the government, more than 30% of our children developed eczema at very young age. Steroid has been increasingly used on kids for the problems, and dependency and withdrawal of topical and systematic steroid discharges for many families. Homeopathy could offer a very gentle alternative for the treatment in these cases. And this is a case of preverbal newborn suffered from suspected vaccine-induced eczema and digestive problems. It can be difficult to find a deep-acting remedy for a preverbal newborn when the indicated polyquest failed to finish all the work. Associating the maternal constitution with the baby's active symptoms can be very useful in these occasions. There is also an increasing use of new remedies. The case demonstrated how limited proving symptoms and rubrics could be utilized. And according to the modified Naranjo criteria for homeopathy, it gives 10 out of 30 points. So it can be considered indicative of a good causality score. That's all for my presentation. Thank you.
Thank you very much. I find your presentation very interesting and really useful.
Thank you.
Our center in Sofia, Bulgaria is working very much with prenatal conditions also. And I could confirm your approach. It's really working like that. And it's also, there is a very big field for us to work in the prenatal phase. So congratulations and keep.
Thank you. Thank you. Thank you.
Dr. Anu Kapoor, ma'am, have any questions?
Very
Yeah.
good, Krista. It was a very
Thank you.
well-read presentation, a good experience to share. I just want to ask how many such cases you have been working on where you have had success?
Actually, usually, if you are talking about eczema, there actually maybe not more than 10 cases I'm working on, but I try to use different approach because my aim is that the recovery of the patient is is the most important things. So I just want to take this case to share with you because this is a quite new approach for, I think, for many people.
No, not only eczema, any other condition also. You have been working on this? Any other condition?
You mean any other cases that I also use this approach, right?
Yeah.
I think maybe 12 to 10 to 20, not really much, because usually when the patient come to me, I will also select polycrest first, see if the polycrest can settle all their problem first.
Dr. Kanchan, ma'am, you have any questions?
Madam, good presentation. Newborn baby treated very, so madam is present very good. Thank you.
Thank you. Thank you.
Thank you. The next presenter is Miss Melissa Martin. She'll be presenting in place of Isabel.
Hola, mi nombre.
Hola.
Hola.
Do you know English?
No, sorry.
Okay.
Hola, mi nombre es Melissa, soy miembro de una de las asociaciones de pacientes de la homeopatía que existen en España. En concreto, soy socia y formo parte de la Junta Directiva de ATAEX, la Asociación de Amigos de la Homeopatía y Terapias Alternativas de Extremadura. Para contextualizar, para quienes no conozcan, en España tenemos desde diciembre de 2018 una plataforma estatal de asociaciones de pacientes de la homeopatía, la cual aglutina a 8 asociaciones que forman parte de ella o que colaboran con la plataforma. Estas asociaciones de usuarios de la homeopatía se encuentran repartidas por todo el territorio español en diferentes comunidades autónomas y la finalidad...
Can you please share your poster on screen?
Excuse me.
There's a share screen below, the green icon, and you can share the poster.
Yo no. Hola, mi nombre es Melissa, soy miembro de una de las asociaciones de pacientes de la homeopatía que existen en España. En concreto, soy socia y formo parte de la Junta Directiva de ATAEX, la Asociación de Amigos de la Homeopatía y Terapias Alternativas de Extremadura. Para contextualizar, para quienes no conozcan, en España tenemos desde diciembre de 2018 una plataforma estatal de asociaciones de pacientes de la homeopatía, la cual aglutina a 8 asociaciones que forman parte de ella o que colaboran con la plataforma. Estas asociaciones de usuarios de la homeopatía se encuentran repartidas por todo el territorio español en diferentes comunidades autónomas. La finalidad de la plataforma es la de sumar esfuerzos en la consecución de los objetivos de todas las asociaciones de usuarios y pacientes, que son, entre otros, apoyar, informar y difundir los beneficios del uso de la homeopatía entre la población. En este contexto se decidió realizar una encuesta de percepción social a los miembros de las distintas asociaciones de pacientes pertenecientes a la plataforma o colaboradores con ella de forma libre, voluntaria y anónima. El objetivo de esta encuesta es reunir la realidad social de percepción de la homeopatía por parte de los usuarios que la utilizan, dando una imagen ajustada a la realidad sobre la composición y motivaciones del grupo, que ayude a clarificar los distintos prejuicios con que habitualmente se nos suelen calificar por quienes no comparten nuestra postura, por desconocimiento o por otros intereses. Uno de los motivos para realizar esta encuesta ha sido por la campaña de desprestigio y descrédito continuado que viene sufriendo la homeopatía, tanto por parte de los gobiernos como por parte de diferentes medios de comunicación social, y por ello es un instrumento más a través del que la plataforma de usuarios y pacientes de la homeopatía pueden ofrecer argumentos válidos ante las críticas y descalificativos que nos dan. La encuesta, como he explicado anteriormente, ha sido respondida por personas pertenecientes a la plataforma estatal de usuarias y pacientes de la homeopatía, y ahora un poco pasaré a resumir los resultados de la misma. Se ha comprobado que entre los encuestados existe una representación de todos los niveles sociales, con una mayor participación de respuestas de personas de género femenino, siendo el 74,4%. El 62,1% de los encuestados tienen estudios superiores, el 19,4% con formación profesional, el 9,6% tienen estudios secundarios y el grupo menos numeroso sería los que tienen estudios primarios, con un 8,4%. Vale. Entonces, luego, por otra parte, en cuanto a la campaña de desprestigio social mantenida de forma permanente sobre la homeopatía, el 39,9% se ha sentido despreciado por los que no la utilizan, el 34,7% tiene temor a decir públicamente que utiliza la homeopatía por posible rechazo social, el 33,5% tiene miedo a ser ridiculizado por profesionales sanitarios que no son afines a la misma, y un 10% incluso le ha llegado a causar dudas sobre la eficacia de la misma. Una amplia mayoría culpabiliza los intereses de la industria farmacéutica, el desinterés gubernamental y la presión al movimiento escéptico de la situación actual de desprestigio. Como parte de la solución, los encuestados ven la necesidad de una mayor educación y formación como manera de poder ayudar a desarrollar socialmente la homeopatía, conociendo los encuestados en su gran mayoría el uso de la homeopatía en la sanidad animal y en la agrohomeopatía. La homeopatía es científica para el 97% de los encuestados y la mayoría, un 65,1% de las personas encuestadas, conoció y decidió realizar un tratamiento homeopático por un consejo familiar o de alguna persona conocida. Un 31,7% lo decidió por iniciativa propia tras el conocimiento del método, un 14,2% por consejo de profesionales sanitarios y solo un 0,6% por información buscada por redes sociales o por internet. Como conclusión, podemos afirmar que con estos datos se contradice la imagen desde posturas interesadas se quieren trasladar a la sociedad. Es decir, la persona que utiliza homeopatía no es engañada a utilizar la misma, está segura de lo que hace, no es analfabeta, está formada adecuadamente, lleva mucho tiempo confiando en la homeopatía porque le ha servido desde hace años y le sirve para cuidar de manera segura y eficaz su salud. Y no son personas fanáticas de tono sectario, pues complementan y ven la necesidad de recurrir a otras medicinas complementarias sin descartar ninguna. Son personas con capacidad para decidir y están en la lucha por exigir sus derechos en salud y ayudar a que esta medicina, por el beneficio social que reporta, sea conocida y no marginada como se la pretende. También indicar que la encuesta sigue abierta y se trata de una encuesta piloto que servirá para planificar distintas medidas a llevar a cabo con la finalidad de cumplir los objetivos de apoyar, informar y difundir los beneficios del uso de la homeopatía entre la población. Y también conseguir unir a todos los usuarios de la homeopatía, que en definitiva es uno de los grandes objetivos que tenemos desde las asociaciones de usuarios y pacientes de la homeopatía. Gracias.
Muchas gracias.
A vosotros. Gracias.
Okay,
Uh,
ma'am, can I request you one thing, Dr. Dora, ma'am? Can you please give it in a nutshell so that the other two chairs can understand what she has said, so they can evaluate her also. Just in a
I
nutshell,
don't, I,
they can
I,
evaluate.
I don't
Only
speak,
appreciate the fluency.
I don't speak Spanish, but I understood from the poster that this is a study of patients who have used homeopathy and for acute situations and for chronic situations or as prevention, and that most of them would like homeopathy to be included in the national health system.
Okay,
Just
okay, good. Okay.
We
That-
would request Isabel and Antonio to please present in the next session, since we'll have a translator there. So if that's okay with the chairs, we can proceed with the others, and Dr. Antonio and Isabel can present in the next session, please.
he doesn't understand what you write, so you can Google Translate and send to her.
Okay, I'll do that.
Okay, thank you. Thank you, ma'am. Okay, we'll go on to the next presenter. The next presenter is Dr. Abhijit Datta. He's from India, and his topic is preparing and presenting journal club content, an essential component of homeopathic learning. Dr. Abhijit Datta.
Yes, ma'am. I hear. Am I audible?
Yes, yes. Welcome. Please share your poster.
Ma'am, is it showing?
Yes, yes.
Yeah. Thank you so much, LMHI and the jury members for giving me this opportunity to speak about this study. Actually, without any delay, I'd like to start with what is journal club. Almost all of us know that journal club is something where it's nothing but a coming together of individuals willing to discuss, critique, or evaluate journal or other literature related content among themselves. So in that case, what happened is there are a lot of literatures, lot of things that is from where we obtain knowledge. And among those, most of the things are nowadays are the research papers, and obviously the homeopathic literatures that is prevalent till now. But what happens is in most of the literatures, we don't critically appraise. But for that, journal club is that practice to critically appraise that particular any of the literature. In that way, in many of the systems of medicine, the journal club is one of the essential educational activities that postgraduates and undergraduates perform. But in homeopathy, nowadays, and other countries who are actually practicing the journal club, because from the journal club, very much incremental knowledges that we obtain by means of critical appraisal. So there are two kind of methods that we can think of while we are reading any paper, or while we are actually critically appraising any paper. What actually we do, we just look into the abstract about that. We just see that what the message the articles wants to convey. We just look into that. But it is not the proper method, because we have to look inside every article and every educational material, that how much bias is involved in that article, how much the article is conveying message, how much the article is tilted towards the methods that the author wants to convey. So in that way, there are many components that we consider upon. So this practice actually involves a meeting of experts and learners so that they can discuss something about that. In homeopathy, this is not so discussed. One of the reasons might be unavailability of proper guideline. So we conducted this study, which involved 2 steps to develop this particular guideline in the journal club. In that, we involved 2 phases in the methods. The first phase was searching the various databases like PubMed, CINAHL, AMID, and Scopus. And after searching, we found several articles, and we did one sentiment analysis. We planned one sentiment analysis so that we can understand that what are the key points that articles tries to convey. In that way, in addition to that, the homeopathic aspects and essential components have been added from the relevant literature. Then thereafter, again, a sentiment analysis was conducted and relevant items were noted down, which entered into the second phase. So the second phase was we just listed out all the important components that we want to consider upon. And after that, we sent all the components to the experts. We selected 9 experts, among those 2 methodologists, 4 homeopathic subject experts, 2 journal club authors who have previously published in a journal club article, and 1 expert from the modern medicine. So what we tried to achieve is we just sent all those documents to the reviewers or the experts of the Delphi method. And after that, we did one agreement in between that what kind of components they want to be in the guidelines. So among that, that article, in that the whole educational material, we first listed out 12 main items and 23 subcomponents. And after that, 3 rounds of Delphi method with 9 experts. 6 items were labeled as essential, 2 situation specific, and 4 non-essential. So the items were like information about the author, the background, and details of the journal article, the general overview of the article, author's perspective, critical appraisal, which was the main stem of any journal club, and critical appraisal in terms of the types of the article. It might be randomized control trial, it might be case report, it might be cohort, case control, whatever it might be. It might be a specific general article, okay, or it might be some homeopathic literature. So after considering all those aspects, we have to critically appraise about the content of the article and main message of the article. Okay, in that way, we actually listed out those items, and this paper in late 2019, we published this paper in the journal Homeopathy. And after that, it was actually the first phase of our study. And following that, we again did one Delphi method to add certain other components, but it is not published yet. So in conclusion, we can say that what we understood from this study is selection of a suitable topic is very critical prerequisite. We cannot just select any nominal articles, because it is actually in turn improving the education of the people that is present over there. Each and every step from preparation to presentation needs to be carefully planned and considered. For the meeting to be successful, the final discussion phase requires the active participation and critical insight of all those attending, because we cannot just speak and people will listen. So that everybody should participate in that, so that we can find out important caveats and importance of the articles. So the journal club is found to be an essential practice for critically appraising an article or any educational material. The framework and guidance have been developed, which might help the readers to present and attend the journal club meeting effectively in later on. So I know a few of the Indian colleges who have actually implemented our article in their postgraduate curriculum, so that student can get the guidance that how they will prepare and conduct the journal club and how people will attend the journal club meeting. So we wish that in future many people will adopt this guidelines, so that the educational system will be strengthened in homeopathy and people will read more and more the educational materials and the research articles. So thank you very much for your patience hearing. And if you have any question, I'd like to take.
Thank you very much.
Yes, ma'am.
Thank Dr. Datta.
Yes, ma'am.
Choice, topic choice is a very good and need for postgraduate and PhD student. So very nice your presentation.
Thank you so much, ma'am. Thank you so much.
I also would like to say I like this presentation and find it very useful. So please, could you send me a link to your article?
Yeah, sure, ma'am. Sure.
If possible, a feedback from colleges or students, practical application, how it works. So maybe we can use it in Europe, but I need to understand a little bit more before suggesting to European Committee.
Yeah, sure, ma'am. Sure. I will share the article link, and I will send all the essential materials that I have obtained so far.
Thank you very much. Congratulations. Thank you.
Thank you, ma'am. Dr. Anu Kapoor, ma'am, you have anything to ask?
Dr. Datta, this is a very good presentation, no doubt. But just to ask you one question, how much you have implemented it? How much scored is it? Are you following it in your institution?
Yes, ma'am. I am following it. Actually, I have just passed from National Institute of Homeopathy. I've just completed my MD. But while I was in NIH, we used thoroughly. It was published in 2019. It was actually published in 2020 April, but we were accepted in 2019. So formally, we are using all these guidelines.
Okay.
And several other colleges also using, like JSPS College. They have also appreciated this.
Okay. That's really good. If it is something universal, it is really good to write such a thing. That's good. Great.
Thank you so much.
Thank you.
Thank you.
Thank you all. Okay, the next presenter is Kartika Chattopadhyay. Professor Kartika Chattopadhyay will be talking on the topic an approach towards multi-dimensional research activities in a model homeopathic academic institution. Welcome, Doctor.
Thank you, ma'am. To all of you, greetings of the day.
We see you.
Yeah, please share your screen.
My topic is homeopathic education with multidimensional research approach in the process of development towards a model homeopathic institution. It's just a description of initiative taken by us recently related to research and development cell in academic setup. The prime pillars of a model medical institution are the quality classroom education, adequate bedside exposure in a highly functioning healthcare setting, and an environment of evidence-based knowledge through research. In higher education, creating quality research environment is not only evolved to gratify curiosity or to cultivate a scientific attitude among students, but also a national endeavor. This environment enhances the professional competence of faculty, helps to quality education, and enrich the eminence of the organization.
Dr. Kartika, can you please move your slide upwards, the poster, a little more? Yes, yes. Can you zoom it a little bit?
Yeah, sure.
A little. Yeah. Thank you.
So keeping in mind the purpose and going beyond Central Council of Homeopathy's prescribed minimum standard of education, Baxter Homeopathic Medical College and Hospital developed its research and development cell recently. The cell has introduced 10 in-house multidimensional research projects with the active involvement of all the faculty members of the college. It adopted a consultative process of experts and the faculty to discuss the researchable and the hypothesis needs to be tested. It was discussed that the homeopathy is the second choice of healthcare system worldwide, followed by modern medicine. The modern and effective medical education demands a thorough integration of theoretical, applied, and evidence-based knowledge exposure. Hence, in a modern homeopathic academic institution, the curriculum-based research studies in postgraduate level and time-to-time short research participation in undergraduate level to instigate quality research among different dimensions, active participation of trainees and trainers are highly recommended. After deliberation, following in-house research projects are undertaken at primary level, covering possible areas in a homeopathic college setup, like involving students, patients, healthcare providers, and community population. The in-house projects are as follows. Number one, assessing the change in attitude towards research among homeopathic undergraduate medical students. Number two, a study to assess the level of patient satisfaction in homeopathy by using 12-item Japanese short form satisfaction questionnaire, a cross-sectional study. Patient satisfaction and quality of life in treatment response of homeopathy, a follow-up study, number 3. And number 4 is an experiment to effect of Beaurivia diffusa mother tincture, Blata orientalis mother tincture, and placebo on the vital capacity of lungs. Number 5 is usefulness of individualized homeopathic intervention in alopecia areata. Next one is psychosocial adaptability, emotional adjustment, and mental health status among college students in a new normal condition and exploratory research. Next is usefulness of individualized homeopathic intervention in the cases of first and second degree hemorrhoids, a prospective clinical study. And the next one is understanding the therapeutic response combined with yoga versus placebo with yoga in the management of knee joint osteoarthritis, comparative randomized clinical study. Beliefs, needs, and perceived stigma towards mental illness, a comparative study based on educational status of Greater Noida population. And the last one is usefulness of homeopathic intervention based on temperament predominance in chronic tension type headache, a clinical study. Progress, the first and second studies mentioned before have been completed and showed statistically significant results, and the rest 8 studies are ongoing. The next level research projects may be initiated in collaboration with Central Council for Research in Homeopathy, Mental Health and Psychology Department, Gautam Buddha University, Greater Noida, Sharda University, Greater Noida, and we are focusing in next level in fundamental research. Thank you.
Thank you very much. Impressive with all the studies you are doing. Congratulations.
Thank you, ma'am.
I would like to get some more information about your first study motivating students. Could you give us some feedback on that, how you work and what you achieved actually?
Actually, this study will be presented in next session today, poster presentation by Dr. Kriti Saraswat in details. It is our, thank you.
Yes, I'm really interested to learn more about this.
Our intention was to motivate students towards short-term research project organized by the Central Council for Research in Homeopathy in every year. And during the time of motivation, we organized some motivational program and pre-motivation and post-motivation questionnaires to assess the attitude towards research of our students, undergraduate students.
Thank you. I hope I will be able to hear that presentation. And I would like to keep contact with you if possible.
Thank you. Thank you so much.
Dr. Kanchan, ma'am.
Hello.
Yes, you're audible.
I'm audible?
Hello.
Yes, ma'am.
Okay, madam. Nice presentation.
Thank you, ma'am.
Next.
Okay, Dr. Anu, ma'am.
Yeah, Dr. Katika, good one. But if you are keeping it to the undergraduate level, it's a suggestion that when you go to, when it is for first years, second years, it should be a preclinical mode of research because they hardly have any knowledge of the clinical subjects. As you proceed year-wise, make it clinical. That will be useful, I think.
Thank you. Thank you.
Thank you. Thank you all. So I'll be calling the next presenter. It is Dr. Shambhavi Chaudhary. She's from India and she'll be presenting the topic, a significance of researchers in the field of homeopathy. Dr. Shambhavi Chaudhary.
Am I audible, ma'am?
Yes, yes. Okay. Please share your poster.
Sure, ma'am.
Okay, our team is contacting her. We'll go on to the next presenter in the meanwhile. So please speak, chairs, please note. The next presenter is Dr. Nahida Hamza. She'll be presenting the topic, is homeopathic research languished in India? A qualitative analysis of scientific and ethical perspectives. Dr. Nahida Hamza.
Yes, madam. Good evening.
Good evening.
Yeah, I'm here. Shall I share my screen? Okay. Thank you so much. Greetings of the day, and thank you very much for giving me this wonderful opportunity to disseminate my research findings. So the title of my presentation is Has Homeopathic Research Languished in India? A Qualitative Analysis of Scientific and Ethical Perspectives. The study was jointly conducted by myself, Dr. Nahida Hamza, and Dr. Uma Kulkarni. So to begin with the introduction, as we all know, homeopathy was founded by Dr. Samuel Hahnemann in Germany. But today, India is one of the leading countries in homeopathic practice, with 2 lakh practitioners and 12,000 getting added every year. Even though homeopathy is recognized under the Ayush Ministry, Government of India, the system is often criticized as evidence of the effectiveness of homeopathic medicine is lacking to a great extent, and research happening in homeopathy is always questioned. So compared to other systems of medicines, both research and publications are lacking, and no specific guidelines are there for homeopathic research in India at present. Therefore, there's a need to explore why homeopathic research is lagging in India. So the objectives of our study was to explore the barriers and enablers in the ethical and scientific conduct of homeopathic research as perceived by the homeopathic researchers in India. The methodology that we adopted is qualitative study design, wherein an in-depth interview of homeopathic researchers were conducted. We conducted interviews of 11 homeopathic researchers over a period of 3 months by snowball sampling technique. The inclusion criteria was homeopathic researchers with 3 years experience in research involving homeopathic medicines. So all interviews of the homeopathic researchers were recorded with consent, transcribed and coded using the WEFT QDA software. Inducting coding was done for narrative analysis of the textual data. And the study was conducted in accordance with the Declaration of Helsinki and the ICMR's National Ethical Guidelines for Research Involving Human Participants. The study was also approved by the Institutional Ethics Committee. So coming to the results of the study, the 11 in-depth interviews of homeopathic researchers, we derived 119 codes comprising the research-specific items, 30 categories of research-related issues, and 5 themes which involved 4 barriers and enablers. So the enablers, the barriers in homeopathic research, we have classified into 4 levels. First is barriers at individual level. So the barriers at individual level include lack of awareness of research, lack of critical thinking as researchers, lack of motivation for research because there are absolutely no benefits or no incentives available for researchers as beginners. And the participants of our study have also expressed lack of knowledge in the mechanism of action of drugs, which posed as one of the major barriers in conducting homeopathic research in India. And they have also addressed that they always feel difficulty in adhering to the protocol and the present ICMR guidelines, which is laid down for biomedical and health research involving human participants. Second is the barriers at institutional level. So barriers at institutional level include lack of infrastructure in institutions, lack of laboratories, animal experiments, lack of funds and training opportunities. And the participants also face ethics committee related challenges when it comes to obtaining ethical approval for their studies. That is, the ethics committee is not aware of homeopathic medicines, the concepts applied in homeopathy or the principles or the concept of individualization. And the homeopathic researchers they receive minimal training in research methods and research ethics, and due to which they feel very difficulty in making the ethics committee understand the terminologies used in homeopathy. Moreover, there are very few ethics committees in research institutes in India, and that's also one of the reasons why obtaining ethical clearance or scientific review board approval for homeopathic research has become almost next to impossible. And our researchers have also addressed that the homeopathic system of medicine is often discriminated within Ayush since it has a German origin, and the funds, when compared to other systems of medicine, are least for homeopathy. And even though there are funds available, the funds are for government sectors alone, and the private sectors receive very least funding. Moreover, the students are reported to manipulate drug provings. That is, they don't consider drug proving very seriously. And it's only at the day of submission of the day book, they write up the symptoms of the book just for the sake of submission. Third is barriers at national or regulatory level, which involves lack of homeopathy-specific guidelines or regulations to introduce a new drug. Also, there are lack of index journals for homeopathy. Even if the homeopathic researchers submit papers to index journals, it often gets rejected because they receive least training in scientific paper writing. And the barriers inherent to homeopathic science include lack of data on animal studies, lack of literature, lack of publications, lack of reproducible research, poor documentation of clinical data, lack of specific treatment protocols, as each homeopath has their own way of prescription of medicine, which is why the system is often criticized. And the enablers in homeopathic research involves newer training opportunities and newer opportunities to conduct research. So the Central Council for Research in Homeopathy has now come up with short-term studentship in homeopathy for undergraduate students to conduct homeopathic research. And a few universities in India is offering excellent training programs in research methodology as well as research ethics, and has opened doors for Ayush doctors to get themselves trained in research methods and ethics. So these are the enablers in homeopathic research. And I've also listed some of the participant narrators, that is, the quotes for the participant have expressed in our study. So one of the participants says, even within Ayush, we are considered the lowest. Another participant said, our homeopathy and research funding is limited to government sectors only. Another participant said, I wanted to test the efficacy of homeopathic medicine, but I did not know how to write a proposal. The last said, we are trying to fit into the shoes of modern science. We have no guidelines. So application of the ICMR guidelines laid for biomedical research is almost difficult and impossible when it comes to homeopathic research and drug provings in homeopathy. So there's a great need to develop guidelines specific to homeopathic research. So to conclude, this study has showed that homeopathic research appears to be languished in India, and there is an urgent need to streamline homeopathic research at all levels, including regulations, funding, manufacturers, ethics committee, academics, infrastructure to encourage homeopathic research. There's a great need to strengthen historical and scientific foundation of homeopathy with evidence and redirect the unmotivated and unskilled researchers and equip them with excellent skills to conduct homeopathic research and support them with good incentives and several other benefits and motivate them to homeopathic research. And the future directions for homeopathic research would be to develop study designs, guidelines, formulate ethics committees in homeopathic research institutes, and make publications mandatory for both postgraduate students as well as faculties, because that could be one of the way to increase the number of publications in homeopathy and also improve the quality of existing journals in homeopathy. And we have also received few suggestions from participants to improve homeopathic research, and that include to validate the law of similia. They said this because homeopathy is often criticized based on the law of similia. Critics always question about the law of similia and the principles that are applied in homeopathy. So our participants have felt a great need to validate the law once again based on the present-day scientific standards and biostatistical analysis. Also, the second suggestion is to develop guidelines, study designs, revise the existing BHMS curriculum and inculcate research into both undergraduate as well as postgraduate courses, mobilize external funding support, encourage genuine postgraduate studies and training in research methodology and research ethics. So with this, I end my presentation. And this is an original work carried out as part of Yenapoya University for Getty International Center's Master's Program in Research Ethics by myself, guidance of Dr. Uma Kulkarni, who's an ophthalmic surgeon. I thank the Yenapoya deemed to be university for encouraging me to conduct this project as part of my master's program. I also thank Dr. Veena Vaswani and Dr. Ravi Vaswani for their intellectual and moral support. Finally, thank you very much to the LMHI and the organizing team for providing me this platform to disseminate the findings of my research. Thank you.
Chairs, any questions?
I think there is great need to appreciate the voice of this young doctor, and it seems to be really the truth of homeopathy. I really appreciate your article, the hard work you have put in, and she has almost covered each and every topic. It is like the true voice of a homeopath, and this is actually the need of the day. That is why evidence-based homeopathy is not able to flourish, because we do not have universal guidelines, and because we are not having research at the level of undergraduate courses, we are not having research at the level of post graduation, and we are manipulating much and being less truthful to ourselves and to homeopathy. So great work, Nahida. Good, keep up.
Thank you, ma'am. Thank you so much. I am looking forward to take this at least for a very small policy change in terms of education in postgraduate colleges, because most of these students are interested in research, but they don't know how to get into research, how to develop their career as researchers.
Yes,
So
and
if the
what I
higher
feel
authorities,
it should be a part of, it should be a subject at the undergraduate level, because unless they are
definitely, ma'am.
coached in that
Yeah.
manner, it is, they will just go in for manipulations,
Yeah,
just to
and the
cover.
reason why I chose this topic and why my guide, being an ophthalmic surgeon, supported me is because both of us believe in homeopathy, and I hold a bachelor's degree in homeopathy. But when we saw the NHS in the UK stop funding homeopathy, and other countries, the Germany holds the origin in homeopathy, but India leads the homeopathic medical system, and India has Ayush Ministry, but other countries don't. So that could be because there are very few publications, and when the critics, even the Australian government, when they conducted a review in homeopathy and banned homeopathy in Australia, it's only because they could not get publications in homeopathy. So I think not only India, but each and every country where there is a homeopathy, where there are homeopathic practitioners, must come forward and give equal importance for both clinical practice as well as research. Clinical
Yes.
practice and research are never on two different tracks. What we see in research has to be applied into clinical practice. So I think practitioners must come forward and join our team as researchers and conduct research in homeopathy, so that our generation is talking about that homeopathy is languished and we have no publications. So at least the future generations should not sit in the same platform and talk and discuss the same manner. There has to be a change, at least in the next 10 years.
Correct.
Thank you. I would like also to share first that your work is very good one. And I personally believe education about research and education, they have to go hand by hand in all homeopathic educational institutions, because really India is having established system while Europe is having completely different approach. I mean, we first become allopathic doctors, and then we study homeopathy. But in the homeopathic education about research is missing, I think, all over the world. At the same time, we have this Homeopathy Research Institute in Europe, and I would like to recommend you to visit their site, because there you will find a lot of research at very high quality. And what happened with Australia is just manipulating data. There is a lot of good homeopathic research which has been intentionally disqualified. So in order this not to happen, we really need more students and more homeopaths to be educated how to do research. Thank you and good luck.
Thank you, madam.
Dr. Kanchan, ma'am.
Yes. Dr. Nishida is a very true physician in India. Our organization is a part of in our Liga. So your voice is very strong, and we will all our things in your presentation. So nice. Little but CCRH is a try to base but some lacuna. We are message your CCRH and our university, Maharashtra Arogya Vigyan Vidyapit, is going on research base. So we will try your answering. Okay, good.
Thank you, ma'am. Thank you so much. It's a great honor. Thank you.
Thank you all. Dr. Shambhavi, she's ready with her presentation. So we'll go back to Dr. Shambhavi. Chairs, please note, this is Dr. Shambhavi Chaudhary. She's from India and she'll be talking on the topic, a significance of researchers in the field of homeopathy.
Yes. Good afternoon, everyone. Sorry for the delay. And my topic of concern for today's presentation is the significance of research in the field of homeopathy. Like in the field of homeopathy, we, as already discussed in the earlier presentation also, there is a great need for the evidence-based practice of medicine and to form a better healthcare reform system. So for this, we need to understand what are the prior steps of research and what the research actually means. Research is a scientific way to investigate into a phenomena or to answer any question with its investigations all done. It is a systematic approach to problem solving, and it is the establishment of the therapeutic developments in the perspectives of theoretical, factual, and application-based methods, which are to be classified like research. It can be classified under different provisions, like based on objectives, based on approach-based precision and nature of findings, what we are finding. But I have chosen the classification according to the National Science Foundation, and it has a threefold classification: basic, applied, and developmental research. Considering to the basic or fundamental research, it is designed to add an organized body of scientific knowledge and does not necessarily produce results of immediate practical value, because it will embrace the origin and unique investigation for the advancement of the knowledge. While in the applied or action-based research, it will solve an immediate practical problem. Coming to the developmental research in the sequence, it is used for the scientific knowledge for the production of useful materials, devices, systems, and methods of processes. Now, these are the three types of researches which are classified, but we are concerned here regarding the two types: basic, fundamental, and the preclinical researches. Coming to the basic and fundamental research, the purpose of this kind of research is to embrace the origin or the investigation for the advancement of knowledge that already exists and contributing to the new knowledge in the form of new theory, new facts, and truth. The problem arises for this research is broad and relates to the broad field of social studies. The hypothesis under this kind of research is formulated based on the rationale, that is, the principles or the reasons that explain a particular course of action or a particular decision. Coming to the analysis, which is done after the collection of all the data, the standardized tests or the parametric tests are to be done for the whole data collected during the process. After this, at the end, conclusion and discussions will be formed in this kind of research are in the principle of generalization, and it may be a new theory or new fact or new interpretation which will be coming out after this process of research, which is the basic or the fundamental research. Coming to the next level, that is preclinical research. The motive or the purpose of the preclinical research is to accurately model in animals or human beings the desired physiological and pathological effect of a drug in order to predict the treatment outcome in the patients. That this will show the efficacy of the drug, that what will be the treatment outcome coming after giving the drug to the patients, and to characterize all the toxicities associated with a given drug in order to predict adverse effects, that is, which is concerned with the safety of the people or the safety of the patient. This preclinical trials, they involve the non-human animal models, because animals are biologically like humans and are susceptible to many of the same diseases and health problems. For this, a proper methodology is to be followed, which includes the good laboratory practices. Minimum basic requirements includes the study conduct, personnel, facilities, equipments, written protocol, operating procedures, study reports, and quality assurance. Now, moving further, for this preclinical research, we have to take a certain kind of steps in consideration, which will include, first of all, we need to identify a drug target, the drug which is to be targeted in our trial. Then developing a bioassay of that drug, that measurement of the concentration or the potency of a substance by its effect on living cells or the tissues. Then screening of that drug in assay is to be done by establishing effective and toxic doses. And finally, after all this, the file for approval as an investigational new drug is to be forwarded. So I would like to enlighten by stating that and concluding my presentation that in homeopathy, there is a great need to discover the answers to such questions through the application of the scientific procedures, so that people would attain a more confidence in the homeopathic treatment of the medicine. If in above presentation, we have just studied about the prior steps of research methodology, which have their own specific purpose and significances. So I would like to know everyone, so that these are the basic steps, and by keeping mind in these all basic steps, we should move further and take our pathy to a long way in the field of research and development. Thank you.
Dr. Annu, any questions, ma'am?
No questions. Very good. She has a very clear-cut vision regarding homeopathy. And yes, research is a hallmark of development of homeopathy. There is no other way in which we can develop. Good job.
Thank you, ma'am. Thank you.
Dr. Dora, ma'am?
I wanted to ask, is this this work of yours is towards students or towards doctors? Do you have any practical application of this?
It's towards both the students and the doctors, and in our academic setup also, that we should be having, either if our doctors are not having the knowledge, or the teachers who are not having the knowledge of how to proceed in the research, then our students will not be forwarded to that kind of level of our medicines to be known, that they are not knowing all the spheres of action of our medicine properly. For that, research purpose is very much necessary, which I feel, and I will like that it is concerned for all of them, like no barriers are there, I suppose.
Okay, good luck.
Thank you.
To implement in practice. Good luck. It's very important. I agree.
Thank you, ma'am. Thank you.
Dr. Kanchan, ma'am? Ma'am, please unmute. Dr. Kanchan?
Yes. Dr. Annu Kapoor is in Delhi. He is a chairperson in our session, and all researchers want more and more quality. So she is convey our message in CCRH. Okay.
Yes, ma'am. Definitely, I will do that.
Yes. She is dynamic lady, and Nehru Homeopathy Medical College is government college. No doubt, Annu Kapoor is sufficient for our solving question.
Ma'am, that's so great of you. But we will definitely approach this issue. Definitely.
Thank you, all of you. We'll go to the next presenter. The next presenter is Anindita Mondal from Delhi, from India. And I invite Dr. Anindita.
Yes, ma'am. Thank you.
Okay, welcome.
Good afternoon, everyone. Myself, Dr. Anindita Mondal. I am from India. My today's topic is the assessment of knowledge and practice of ethics in the field of homeopathy research among the homeopathy researchers in West Bengal, India. It is a mixed method ethical study under the guidance of Dr. Ravi Vaswani, sir. So, in the background, the fraternity of homeopathy doctors in India is increasing at its rapid pace. So, obviously and consequently, the research related to the homeopathy also in the way of rise. So, the West Bengal, India, where the participants are hailing from, there they have the 4 postgraduate college and many private and governmental research center where the many homeopathy research is going on. But we observe that the majority of the research is lacking its quality. So when we search for the cause of this, so we get that there is a lack of knowledge in research methodologies and the poor research training, which is lead to an unethical research output afterwards. And also the research ethics is now very much important, and all the researchers should follow the ethics in their while they are conducting their research. And obviously the other field or different field of researchers, they are assuming it and practice it in their research field. So we undertook this study to assess the ethical knowledge of researchers and practice related to homeopathy research. Also, we did not get any single article about the assessment of knowledge and practice of ethics among the homeopathy researchers. So our aim for this study is to assess the extent to which homeopathy researchers, that means postgraduate students, researchers from the research centers and the research guide, as well as the postgraduate training guide, West Bengal, India, are aware and practice ethics in the homeopathy research field. We consider 3 domains in this study, that is informed consent, vulnerability, and privacy confidentiality. We know which are the main components to conduct any successful research in any field. And also we are referencing ICMR guideline, National Ethical Guideline for Biomedical Research 2019 for our referencing purpose. So we choose mixed method. Because there is no tool available in the public domain to assess the knowledge and practice of homeopathy researchers in their research field. So in the qualitative study, we have done one-to-one in-depth interview until the information saturation. So lastly, we got 8 interviewees, and then we transcribe all the interview and analysis them by the manual coding process. We use the color code process. The code according to the categories, and these categories and the domain we took for the research, this to help us to extract the themes from them. So lastly, we got 12 themes that help us to prepare the first draft of questionnaire, which is we validated from one ethicist, one clinician, and one researcher. After the took the suggestion from them, we prepared the second draft of questionnaire, and then we finalize this questionnaire, and it had 30 items of statements. Among them, 12 are knowledge-based statements, 16 are practice-based statements, and 2 are survey-based statements. Then we made a link in Google Form with the participation information sheet and the informed consent, and run into the 66 participants, which is our study sample. Then we analyze the data by the descriptive statistical method. So in the result, I already discussed that the qualitative part, we extract the themes to prepare the questionnaire. So, but in the quantitative part of the study, first we distribute our participants distribute the participant according to their response who are participating in our study. The first research experience wise. So here we got the less experience wise participants more, and then distribute the participants age wise. We got the younger researchers more, and then we participate the designation wise. So here we got the most participants are postgraduate training. Then we distribute the participant their qualification wise. Here we got the most of participants are BHMS students. So this 4 graph which analyzes that there is many cause behind this to participate in our study. So we can say that we get the research experience was less, and all are postgraduate training. So that means they have to do the research for their MD curriculum. So after that, we analyze our statements by the incorrect and correct answer wise. We saw that so there are 12 knowledge-based statements. Among them, 7 are incorrectly answered by them, and the practice-based, there are 16 practice-based statements. So among them, 9 are incorrectly answered by them. So as a whole, if we took this, so there are 16 incorrectly answered by them among the all 28 questionnaires. So it means there is a lack in the knowledge of ethical issue arising in the research field as well as the practice it in the research field. So after that, we evaluation the statement, that same kind of statement wise. So here we use two same kind of question in the both the segment, the knowledge-based statement and the practice-based statement. Here we saw the correctly answered knowledge-based statements are dropped in the practice-based counterpart. So here we can analyze is that the knowledge is there in the research homeopathy researchers, but the proportionate of translation it in the practice part is less. And you can see in the graph also that the graph is decreasing and the correct answer is decreasing that way. And last, the two survey-based statement, here we got that all the maximum of the participants are agreeing to have a different ethical guideline for homeopathy research as well as for the clinical trial. This is used to both graph, I think. So we conclude our study that there is a need to conduct more awareness program for research ethics in homeopathy and try to apply them while they are conducting the research. And also there is a need to construct a research ethical guidelines that is only for our homeopathy research. And this more encouragement is there for the future researchers, for the future generation to conduct good quality research using the best ethical standard, and which will lead to increase the trust of the society of our study, our homeopathy system. Thank you so much. I thank you LMHI to give me the platform to share my work, and also I thank you Dr. Veena Vaswani ma'am, who is the program director of Homeopathy International Center Research Ethics Masters Program. Thank you.
Thank you. My connection was not very good, so I couldn't listen and I cannot talk about this presentation.
Okay,
Dr. Anu?
Anandita, it was a good job,
yes,
definitely. But what was the practical outcome of your research work of this paper? Anything which is being followed in your state as of now?
No, ma'am, but further I will try to do it in other state also.
Yeah, like you propose that it should be followed. That's it.
Yes, ma'am.
Good.
Thank you, ma'am.
Dr. Kanchan ma'am, any questions?
No, madam.
Okay, ma'am,
Okay,
we
next.
have shifted the next presenter to the next session because there'll be a Spanish translator there in the next session. Hope you have all evaluated the presenters, the Google Sheet provided. Please, chairs, please say a few words and conclude the session.
Thank you very much to all the participants. It was a pleasure to see young people doing research about research and about education. I personally believe this is the core. We need to invest all over the world in education and in research, and only in this way we will assure a better future for homeopathy. So thanks to all participants.
Dr. Anu Kapoor, ma'am.
Yes, I really congratulate all the participants. They have really, their voice is the voice of homeopathy. They are young budding doctors coming up with very true lessons to give. And I really hope that they are incorporated and this is the only way in which we can really get the evidence of homeopathy. So it is my wish that all these things are incorporated, because research is an integral part of education. I really feel that these should be subjects which should be taught at the undergraduate level itself. And that is the only approach which is going to lead the students towards proper research methodology. So with this, thanks a lot. Thanks, Dr. Shiri, for conducting the session so well. Good.
Okay. Dr.
Yes.
Kanchi ma'am, a few words. Okay. Thank you. Thank you all. We'll meet in the next session. Thank you so much.
Dr. Shirin Madam.
Yes.
Good conduct this session. More question in this session. Liga is an international platform,
yes,
for learning and understanding. Research is always going, budding in our pathy. So many improvement in research. Participate want to more knowledge and more platform in the researcher. CCRH is a workshop for research going student and teacher. And more than research lab in our country, want to more research lab in our country, student visit for the approach the student. So easy access to research e-library in separate site. So more knowledge got student. And I am educationist, so I will like this session and more learn in this session. Kindly session, more discussion and point are conveyed. Dr. Anu Madam, Dr. Dora Madam, and our organization committee through your message. So thanks for organizer and participant. Best try to today's session.
Thank you, ma'am. She's left. Okay. Those are all nice and motivational words for the upcoming homeopathic doctors. Thank you, both of you, ma'am. Thank you, Dora, ma'am. Thank you, Anu, ma'am.
Thank you. Thank you, Shirin, Dr. Shirin.
Yeah.
And Dr. Anu. Thank you.
Thank you, Dora ma'am.
See you. All the best.
See you.